name is Emily. I'm going to be your student nurse today. Let me wash my hands real quick. Can you tell me your name and date of birth, please?
Elizabeth Sutton, August 28th, 1994.
Perfect. Let me check your wristband. We have dual identifiers. I'm going to provide for privacy, make sure the curtain's closed. We're going to maintain your safety throughout this assessment as well. Do you have any pain today, Elizabeth?
I do not.
Okay, so on a scale of 0 to 10.
0.
0. Perfect. Can you tell me what day of the week it is?
It's Wednesday? It's
Yes,
Wednesday. It's
that is
Wednesday.
correct. Can you tell me the date?
The last day of Mod 2.
Nice. And what are you doing here today?
Filming this health assessment video.
And lastly, where are you at?
MNU.
Perfect. I can see that you're alert and oriented times 4. You're well articulated for your native language. We checked your weight and height earlier, and your nutritional status is well nourished. It looks like you're sitting in a very comfortable position. Your face seems calm, collected, relaxed a little bit. Your mood seems calm, collected. You do not appear to have any physical deformities. I can see that your skin, from what I can see, is intact, clean, and dry, but we'll be monitoring you throughout the assessment. Also, if you have any pain today, let me know. All right. It seems like you have very good personal hygiene. I can see that you're well groomed. You're in scrubs, so obviously you made a good career decision with your life. First, to get started, we're going to look at your external eye features.
All right.
Let me grab the pen light. We're going to start by testing your fields of vision. So I'm going to have you stand up. You're going to cover the same eye as I do. We're going to be an appropriate distance at the same height. I want you to tell me when you see my hand come into view, okay?
Okay. See. Yes. 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 Yes.
All right, so your fields of visions are good. The same as that side too. That side was good. Now we're going to the other side. Tell me when you see my hand.
Now. 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 Now.
Okay, we did some extra just to make sure we're on the same level. Your fields of vision is the same as examiners. I can see that your cranial nerve 2 is intact. Next, we're going to do the corneal light reflex. I'm just going to have you look straight ahead at me. Through the corneal light reflex. Looks good. Now we're going to do the 6 cardinals fields. So, I'm going to have you look at the pen light and follow the pen light. It looks like your eye movement is equal bilaterally. There's no nystagmus, which is the moving of your eye when you're looking for. Your pupils dilate equally and are well accommodated. They are reactive bilaterally to light, and the pupil size is 4 millimeters. We can tell by all that information that your cranial nerve 3, 4, and 6 are intact. Now, I'm going to put on some gloves. And we're going to look at the external structures of your eye. So, I'm going to have you look at me. I'm just going to look up. I'm going to look down a little bit, down a little there. I can't see any drainage. There's no swelling or redness. Your eyelids are, your eyelashes are distributed equally. There's no lesions. The skin looks intact. It's dry and appropriate for ethnicity. So next, we are going to move on to the whisper test. I'm going to stand behind you and have you tell me what words I whisper.
Health assessment. 100%.
Perfect. I can tell by the whisper test that your cranial nerve 8 is intact. Next, I'm going to look at the external structures of your ear and let me know if anything is painful. The external structures of your ear look good. There's no swelling, drainage, or redness. You don't appear to have any pain, which is good. Next, we're going to inspect your mouth. For that, do you mind if I use this? I'm going to use the last sterile cotton swabby thing. intact, your teeth look well hygiened, your lips are pink and moist, your smile is equal bilaterally. I'm gonna have you open your mouth and say ah. Perfect. Your uvula rise and fall is midline equally. Your soft palate is intact, and by that we can see the cranial nerve 9 and 10 are intact. I also like you to stick your tongue out. Can you move it side to side? Perfect. Your tongue is symmetric and midline. So from that we can see that your cranial nerve 11 is intact. And since we did the midline test, we don't need to do the gag reflex test because this one is in, the other one is. How's this assessment going for you so far?
It's good. It's good.
Good. Okay. Next, we're going to test the facial symmetry. So I'm gonna have you smile. Can you do this? Also, you can sit back down on that if you want to. So you don't have to stand the whole time.
Yeah.
You puff out your cheeks. Perfect. The cranial nerve 7 is intact from that. Next, I'm going to look at your hair, inspect your scalp, your skin. There appears to be no dandruff lesions, any deformities that I can see. Your cranium is normal cephalic. Next, I'm going to do the cranial nerve 5 test. And by that, I'm gonna have you see your hand. This is considered a light pain, okay? This is a sharp pain.
Okay.
I'm going to touch a part of your face and I want you to tell me what pain it is and where I'm touching.
Okay.
So close your eyes for me.
Light upper left forehead.
That is correct.
Sharp mid right cheek. Light lower cheek left. Sharp upper right forehead. Light cheek left. Light right jawline.
Perfect. So that we can see your cranial nerve 5 is intact because you knew the difference between the light touch and the sharp touch. I'd also like you to close one nostril. Can you breathe out of it? Perfect. Can you do the other? I can see that your nares are patent. Next, we're going to look at the temporal mandible joint, the axillary, and the frontal sinuses. Okay. So I'm gonna feel your jaw. Can you make it clench? Can you open your jaw? Close it. By doing that, I don't feel any crepitus, clicking, or popping. I'm gonna inspect your sinuses now. So I'm gonna start up here. We're gonna palpate. Any pain?
Nope.
Perfect. I can't palpate your sinuses, which is good. That's normal. Next, we're going to look at the pre-ocular, post-ocular, occipital, and submandible lymph nodes. So I'm gonna palpate all of those. Let me know if you feel any pain with this. I should not be able to palpate any of your lymph nodes. And I don't appear to. Okay. Next, we're gonna check your carotid pulse. I'm gonna do one at a time. I'm just going to feel for it. Your carotid pulse is +2 equal bilaterally. Next, we're gonna do the range of motion. So I'm gonna have you look up and down, side to side, circular. Can you shrug your shoulders? Okay, now I'm gonna put my hands on your shoulder and shrug against me. And look against my hand, and the other way. By doing the range of motion, it is +5 and your cranial nerve 11 is intact. Next, we're going to check your arms. Can I have your arms, please? I'm gonna feel for your pulses at the same time. They are equal bilaterally, and your pulse is a +2. Next, I'm going to have you do the range of motion with your arms, so up and down. Can you turn your wrist? Can you open and close your hands? Perfect. So we're gonna do that against resistance now. So I'm gonna be push against my arms, pull against my hands. Perfect. Now can I see your nails? Can you flip them over? Perfect. So I'm looking at your nail bed. I can see that the cap refill is under 2 seconds, which is good. Your nails show no signs of clubbing, any deformities, or issues. All of your skin so far has looked good. I'm gonna be assessing your skin throughout. So far it's all been clean, dry, and intact. I'm gonna do the skin turgor test real quick, and I'm just gonna pinch above your clavicle and see if your skin tints. It does not, so you do not have any skin tinting. Next, we're going to start with the frontal chest. I'm going to listen to your respirations. I'm gonna have you take a couple deep breaths. Your respirations are good. I saw no signs of distress. Your breath sounds were equal bilaterally. Was there any tenderness?
Nope.
Perfect. I did not feel any lumps, masses, or lesions, which is good. All of your low sounds were clear. Normal respirations is 18 to 20 a minute, and I counted 16 on yours, so that is perfect. Next, I'll have you lie on the table with your feet this way and your head that way. So normally, if we were doing this in a clinic, I would have a pillow for your feet and I would have a pillow for your neck as well, but we don't have that, so we're gonna do what we have. I'm going to first start by inspecting. Normally you would be in a hospital gown, so we would be doing this under clothes, but not today. So all of your skin looks normal, intact, dry, appropriate for ethnicity. I can see that your umbilicus is midline, which is perfect. Next, I'm going to auscultate for bell sounds. I'll start in the lower right quadrant. Upon oscillation, I heard bell sounds, which were normal, active. We're gonna listen. We listen at each spot for 15 seconds. We will listen longer if there was no bell sounds heard, but since we heard bell sounds, we don't need to do that.
Alright.
We also listen to the vascular sounds over the aorta, which were normal as well. Next, we're going to do light palpation. So let me know if any of this hurts. We're just feeling for any masses, lumps, or tenderness. Also gonna palpate over the aorta to see if I can feel that. So I was not able to feel that, but that's normal. I listened over the aorta earlier and I heard vascular sound, which is good. Next, we're gonna do deep palpation.
Okay.
I did. Did that hurt at all?
Nope.
Perfect. Next, we're gonna percuss. We're gonna start by your lungs and go down. We wanna hear dullness over your organs. And tympany over your abdominal section. Perfect. I'm gonna have you sit up now, again. Throughout all of that, I was inspecting your skin and it was clean, dry, and intact. And you would let me know if there was any pain, so we assess pain throughout as well. We're going to start by listening to your heart sounds now. I'm gonna have you lean forward a little bit and take a big breath. Perfect, and actually I'm gonna have you lay back down and turn to the left so we can listen. To the left. Sorry. We're gonna start up here. Perfect. seconds, but because we're trying to save time and be able to upload this, we're not gonna do that today. Next, I'm going to inspect your apical pulse, which is in the fifth intercostal space. So I'm not able to see that or palpate that, which is normal in adults. Now we're gonna listen to your heart by listening in 5 spots. We're gonna start with the aortic, which is in the right second intercostal space. Beat this side. We're gonna move to the pulmonic, left intercostal space. The arcs point, which is the third left intercostal space. The tricuspid, which is the left fourth intercostal space. And the mitral, which is the fifth lower intercostal space, left fifth intercostal space. Perfect. All of that sounds good. I heard S1 and S2 sounds, which is normal. We did not hear any S3 or S4 sounds. Your apical pulse was a +2 and regular. Your heart rate was regular. We got that through your vital signs that we did earlier, but we double checked that it was regular here too. Now I'm going to have you turn around if you're able, if you can. So I'm gonna have you take some big breaths. So I saw that your thoracic is symmetrical. Your ribs were downward sloping. Your scapula was symmetrical and in alignment. I'm gonna have you lean forward a little bit so I can palpate your sinus process. I want to start at the C7 and go down. It was straight with the costal vertebral. It was straight, which is good. Next, we're gonna do the costal vertebral angle, and that is down here. I'm gonna let me know if this hurts at all, okay? Okay. So by doing that, we checked the kidneys and they seemed good. Next, I'm gonna have you turn back around. But I wanna listen to your lungs because we did that on the front, we've gotta do that on the back. We listen in the 9 spots. So we'll take a couple deep breaths for me. We will listen for full respiration, but we're obviously not doing that today either. I think that is all we need to listen to. Your lung sounds were clear in all lobes. There were no advantageous sounds. We did not hear any advantageous sounds when we listened to the front either. So I'm gonna have you take off your shoes and socks. Perfect. I'm gonna start by assessing your skin, looking for any varicose veins or signs of edema. We're gonna palpate a little bit to see if we can see any signs of edema. We don't, which is good. Next, we're going to palpate your pulses, your posterior tibialis pulses at the same time.
And that's done on the inside of my ankle.
That is correct. We are on the inside. So they were equal bilaterally. I would say the pulses were a +2, which is what we want. Next, we're going to do the dorsal pedis, which is on your top of your foot. Those also appear equal bilaterally with a +2. Now we're going to check the range of motion that you have on your feet. Can you turn your feet inward, outward? Can you do flexation, up and down, point your toes? And can you, now we're gonna do that against resistance. So I'm going to put my hands on the top of your feet and have you pull backwards and push my hands. Perfect. Your range of motion was, and your strength was a +5,
Alright.
which is what we wanted. Are there any other questions you had for me, Elizabeth?
Not today, Emily.
Okay, perfect. I just want to mention that we were assessing the skin throughout. We maintain patient privacy and safety.